All right, let's talk about the NCLEX. You know those maternity questions? The ones that sometimes feel like they're written in a totally different language? Well, they're not just a roadblock, they're actually a code. And in this review, we are going to hand you the keys to crack it. So here's our game plan. First, we're going to talk about how to think about these tricky questions in a whole new way. Then, we'll get into the nitty-gritty of fetal circulation and development, not just memorizing stuff, but actually applying it. After that, we're taking on the big one, the select all that apply question. I've got a simple trick that's going to change everything. And finally, we'll wrap it all up into a winning strategy you can take with you on test day. You know, the biggest thing to remember about the NCLEX is that it's not just a trivia test. It's a test of your clinical judgment. It's designed to see if you can take what you know and apply it in a real situation, just like you'll be doing at the bedside. It's all about learning to think like a nurse. And hey, you're not in this alone. This entire guided review comes to you from Dr. Abdu Karim. He knows how confusing these multiple choice questions can get, and he wants to give you the tools to clear up that confusion, master the material, and walk into that exam feeling totally confident. So what's the real secret, right? How do you stare at 4 options that all look kinda right and consistently pick the right one? Well, it's not some magic trick. It's a strategy, a repeatable strategy. And that's exactly what we're about to break down. Let's get into it. Let's kick things off with a classic NCLEX topic, fetal circulation. But look, we're not just going to list off a bunch of facts. We're going to connect the core concepts of physiology directly to a practice question so you can see exactly how this knowledge gets you the right answer. Okay, first, a super quick review. Just remember, a fetus isn't using its lungs yet, so it has these 3 amazing bypasses, these shunts. The ductus arteriosus and the foramen ovale, they both work to bypass the lungs. And the ductus venosus, that one bypasses the liver. 3 structures, 3 distinct jobs. Got it? Good. Okay, ready for a question? Here we go. It asks, which statement by a student shows they understand the ductus venosus? Just take a second and read through those 4 options. Now, let's attack this strategically. First step, what is the question actually asking about? It's only about the ductus venosus. Forget the other 2 for a minute. Now look at the name itself. Venosus. What does that sound like? It sounds a whole lot like vein, right? That's it. That's your clue. Now just scan the options for the word vein. And there it is. Option 3 is the only one that connects the umbilical vein. Just like that, you found your answer. And hey, don't just take my word for it. This is literally the official rationale from the Saunders Guide. It tells you straight up to connect the word venosus in the question to vein in the answer. You see, the clues are right there if you know how to look for them. Okay, that was awesome. Let's use that exact same critical thinking for our next topic, fetal development. The NCLEX absolutely loves to ask when questions, so knowing your timelines is a huge advantage. So, take a look at these key milestones. Now, pay really close attention here. Notice at week 9, it says differentiation begins. But then down at week 16, it says the sex is visually recognizable. See the difference? One is when a process starts, the other is when you can actually see the result. That subtle difference is pure NCLEX gold. And wouldn't you know it, here's the question that's designed to test that exact detail. A client wants to find out the baby's sex. The nurse says they can at 16 weeks. Why? Is it because of the appearance of the genitalia or the beginning of differentiation? Think back to that timeline. And there's our answer. It all comes down to timing. Differentiation starts way back at week 9, sure, but you can't see anything on an ultrasound until around week 16, when the external genitalia have actually appeared. Knowing the difference between when a process starts and when it's observable is what gets you the point. Okay, deep breath. It is time to face the beast, the select all that apply question. I know, these can be so intimidating, but I'm going to show you a super simple approach. I call it the true or false method that turns one giant scary question into a few easy ones. So here it is, our SATA question. The nurse needs to teach about fetal circulation. We have to pick all the statements that are correct. Now, your first instinct might be to try and figure it all out at once, but don't. Let's just take it one by one. Okay, let's use our strategy. We're going to treat each of these like a mini true or false quiz. Number 1, the ductus arteriosus allows blood to bypass the fetal lungs. Is that true or false? That is absolutely true. Select it. Number 2, one vein carries oxygenated blood from the placenta to the fetus.
Yep, the umbilical vein. That's true. Select it. Number 3, the normal fetal heartbeat is 160 to 180. Wait a minute. No, that's too high. The normal range is 110 to 160, so that one is false. Don't select it. And finally, number 4, 2 arteries carry deoxygenated blood away from the fetus. Yes, the umbilical arteries do that. That's true. Select it. See? By breaking it down, we know with confidence that 1, 2, and 4 are our answers.
And once again, the official rationale backs us up. It tells you to focus on the core facts. How many vessels, which way the blood flows. Our true-false method forces you to do exactly that, but for each statement individually, which makes it so much less overwhelming. We have covered so much good stuff. So for our last step, let's bundle all these techniques together into a simple, powerful toolkit that you can take with you right into the exam room. Here it is, your NCLEX question toolkit. First, always figure out what the question is truly asking. Second, hunt for those little clues in the words, like we did with venosus and vein. Third, don't just pick the right answer, know why the wrong answers are wrong. Fourth, whenever you can, visualize it. Actually picture the blood bypassing the lungs. And finally, for every single SATA question, just breathe, slow down, and use the true-false method. And I really want you to hear this. This is the most important part. These strategies, they aren't just tricks to pass a test. They're the real deal critical thinking skills you're going to use every single day as a nurse. Figuring out the real problem, looking for clues, ruling out the wrong paths, that's what nursing is. You're not just practicing for a test, you're practicing to be a great nurse. So, as you head back to your studying, I have a question for you. Which one of these strategies are you going to intentionally use on your very next practice test? Just pick one. Try out the true-false method. Look for the word clues. See how it feels. See how it helps you crack the code. You can absolutely do this. You got this.